Right. It's 18:05 today, the 1st of August 2020. I think we are good to start. Hello, ladies and gentlemen. Welcome to our fourth CamDoc webinar. My name is Dr. Valentine Gua. I'm a consultant physician in elderly and acute medicine, and I'm the education lead for CamDocUK, and I'll be your moderator for today. We have a very beautiful discussion lined up for you, which is a continuation of CamDoc's engagement with the community. And for those of you who are watching our webinar for the first time, just a bit of a short introduction why we started this webinar. We know the COVID-19 has impacted seriously on our people, and by that I mean the Black, Asian, minority, and ethnic group, both in the UK and all over the world. And looking at the UK statistics, it did emerge that in this group, the Black community faced quite severe consequences of this pandemic, both in terms of mortality, so the death, and the morbidity, the serious sickness. And the serious sickness and death were not just COVID related, but were also non-COVID related. And we also, from the data, learned that those who, among the Blacks who were born out of UK and Ireland, had severe disease than those who were born in UK and Ireland. And also we learned that those who were born in Africa, those who were born in Central and West Africa, had more severe disease than those who were born in South and East Africa. And don't ask me why, there's a lot of reasons why, but as my juniors will always say, those of us who were from Central and West Africa came out last cocoa, I'll put it that way. Not a very inspiring data. It was a very humbling data, and CamDocUK took upon itself to take its responsibility, which is reaching out to its community. And so we started this webinar as one of those aspects of reaching out to our communities. There are a lot of them. We'll talk about the other aspects in the later webinars. And so we set up a series of webinars, and today we're talking about flying during this pandemic of COVID-19. How safe is it? We know it has been a big issue when the COVID-19 pandemic came through. If anybody had told us this same time last year that we will be where we are this year, I'm not sure any of us would have agreed. We took it for granted that I can drive 5 minutes down the road onto the next train station, catch a train to the next airport, and fly to Brussels for my party that same day. But now we are stuck as many countries shut their borders down and many airlines cut down the amount of flights that they were having. It is said that in April, 95% of the flights were reduced as compared to this time last year. Well, we thank God things are getting better and flights are opening up. But does that mean that they're safe? Because that has always been the big worry, are the flights safe? We know that on the 8th of June this year, the UK put a quarantine measures for those coming from certain countries in the world. And as recent as a few days ago, Spain was added to that country, which means that they consider anybody from that place not to be safe. And so the discussion today will center around the safety of flying during this pandemic. I'll be joined as a moderator by two co-moderators who are two fantastic ladies of CamDoc, Dr. Linda Bello, who is our current chair lady, and Dr. Montio Morgan, who is our past chair lady. They'll be our co-moderators for tonight and do the fantastic work in the background. And I'll also be supported by two fantastic team, members of a fantastic team, Dr. Chris Chen Dimala and Dr. Ann Bennett. They're the ones who've done the beautiful work that we're having this webinar today. Just a few housekeeping rules before we crack on. We will have two speakers today, two fantastic speakers. Each will talk for between 10 to 15, up to 20 minutes. And after each person speaks, we'll have 5 minutes for questions before we go to the next speaker. And after all that, we'll have 30 minutes of general questions and answers. Our co-moderators will pick up the questions and they will flag them, either respond in real time or for us to respond on the program. And so when you have any questions, please go down to the Q&A button at the bottom of your screen and put your question, and the co-moderators will pick them up. Can I just, while we have this conversation, make a few disclaimers? All of us speaking here today are professional people, well trained in our jobs. We work for organizations and for hospitals and trusts. What we're saying today will be our personal input. We're not saying it representing our hospitals, organizations. We're saying it as professionals on ourselves. And that said, there are also some respiratory problems that warrant people who need to fly to seek expert opinion. We are by no means giving that expert opinion in this webinar. What we're saying is the safety of flying in the COVID area. So if anybody thinks that it has any respiratory problem that needs a doctor review, be it TB, be it asthma, COPD, bronchitis, or cardiovascular problems, seek the opinion of your doctors before you're flying. And of course, and as the UK government has clearly said, if you think you have COVID, then you shouldn't be flying in the first place. That said, can I now introduce to you our first speaker for today? She is Dr. Mathilde Mbok. Dr. Mathilde is an associate specialist in cardiology and internal medicine at the St. George's Hospital in London. She also dual accredited as a GP, and she's a clinical skills lecturer at the university. Dr. Mathilde Mbok is the founder of the Mahola Health Foundation charity in Cameroon, which does a lot of fantastic work as part of giving back to their community. But most importantly, Dr. Mathilde Mbok is a frequent flyer. She flies regularly to Belgium, to France, all over Europe, and to Cameroon, to both training, learning, education, to see family. So she has a lot of experience, not just in flying, but in having an expert eye. So I'm sure she'll be able to tell us the nitty-gritty of flying in this difficult period of COVID-19. Dr. Mbok, the floor is yours.
Thank you, Dr. Balingwa, and welcome to everyone attending this webinar. And I will reinforce the disclaimers that you have actually already elicited, but I think it's always important for each of us to set those disclaimers. As you rightly said, I am sharing my personal opinion, and I'm not representing my NHS nor my NHS Trust, nor the NHS as a whole organization. I may signpost people to websites that are endorsed by the Public Health England, NHS England, or gov.uk, or WHO. The second disclaimer is that I do not hold any financial contract or any incentive from any airline as we speak, and in the past or probably in the future. And the third disclaimer, which is important to say, is that I chose to speak about my experience from traveling to the countries that I have visited during the pandemic era. So mainly Belgium, France, and Cameroon. I haven't visited the other countries during this challenging time. So I would basically, I'm afraid, restrain my experience to those three countries because we talk about a specific time flying during the pandemic era. But I am happy to answer to any questions related to anywhere else if I can. The problems being and the challenge being that things evolve rapidly and each country tends to set their rules. So it's important to check every time you travel to a different country, what are the criteria to be let in. Well, as Dr. Mwa said, I am a frequent flyer, whether it's a good thing or not, I don't think we are here in a judgmental discussion. But I happen to fly and I happen to travel regularly for many professional reasons. Being, for example, I travel to Belgium. I used to travel on a weekly basis, now on a 2-weekly basis, because I'm currently doing my training in interventional cardiology in Belgium, in Brussels, where I actually train as a medical doctor. So, and in France, I am traveling on a regular basis there because of my family circumstances. My mom being a patient at one of the main rheumatology centre in Paris. And obviously to Cameroon, I do travel regularly because of my charity commitments, because of my family commitment. And people will know me, know how close I am to my dear father and how important I thought it is to try to understand and to practice medicine in Cameroon and to teach, if possible, our youngsters back home. Now, having said that, as Dr. Ngwa mentioned, 12 months ago, we wouldn't have been able to say that we will live in a very tricky situation in time when just the thought of traveling becomes a nightmare for a lot of us because of a lot of restrictions or a lot of challenges. Now, to travel to Europe, to continental Europe, traveling to Brussels or France nowadays, I think it's not as challenging as traveling back to Cameroon. So I think now, and recently, we were able to travel without applying for filling out a form to France. And but we have to, it's still compulsory to fill out a form when you're returning back to the UK. So you have to be able to know that. Now, the main challenge, I think, and it's my personal experience, is when flying to Africa, when flying to Cameroon. First of all, it's very difficult to have the airlines, the fares are higher than previously, and it is also important to make sure that you have a good transport link from where you fly into to where you would like to land to, whether it's in Douala or Yaoundé when it comes to Cameroon. It is important also to know that if you hold a foreign passport, it's important for you to have a visa, a valid visa. And in order to apply for a visa, you have to present a recent, less than 72 hours, negative COVID-19 test. And it's not all the COVID-19 tests you have to show. The Cameroonian authorities would like you to show the PCR antigen test, which is very simple. In a simple way, it's the swab that they put into your nostrils and at the back of your throat to show that you haven't been recently exposed to COVID-19. It obviously needs to be a negative test and less than 72 hours. If you do present the antibody test, you won't get your application reviewed. So you have to bear in mind that it should be the PCR antigen test. And how to get that test? At the time I traveled to Cameroon, I had to go privately, and unfortunately it's expensive. Now I think you can have the test through the CamDocUK website and type coronavirus test and put your location, and you will be given different addresses where you can have the test done there. As usual, when you're traveling to Cameroon, you need to think about malaria prophylaxis, because it's not only because there is now COVID that we shouldn't think about the other deadly illnesses. It's very important to get your malaria prophylaxis ready. And it's generally advisable to get the prophylaxis few weeks if it's mefloquine, few days if it's Malarone before you travel. The reason being that you need to have sufficient drug blood levels in order to protect you for protective effect, and also to show or to check whether you're not displaying the side effects related to that medication. For those of us who are frequent flyers, there's a school of thought from the WHO saying that if you travel in an endemic area every month, sometimes you have to consider yourself as a resident. Therefore, you may not require the chemoprophylaxis, but you have to be ready every time you have a fever, to bear in mind that this could be malaria and to seek treatment. If it happens in Cameroon, then you can easily get access to the rapid test, because it's an endemic disease and people are quite clued up and quite ready to treat you for that. If it's in England, you have to talk about your travel history. You have to tell your physician that you have traveled abroad, that you have been in an endemic area. Otherwise, they wouldn't think of malaria as part of your differential diagnosis. Now, when you have been granted with your visa, the next step is when you travel. If you travel to Cameroon, it's important for you at the time you board to have a very recent COVID test, the same PCR antigen test, the same swab nasal and throat test. So it depends how soon you have made your application. So sometimes you have to do 2 tests, and I had to do 2 tests because there was a week gap between the time when I applied for the visa and the time when I was flying. If you do not have that test, you won't board. And at the moment, there are major delays because so many people are still trying to turn up without a valid negative COVID-19 test result. So bear in mind that you should get that on top of your normal frequent flight recommendations and requirements. We still have to think about the medication for the traveler's diarrhea, and that is, as a clinician, the advice I would always say to people, depending where you land, whether it's in Douala or in Yaoundé or in a more remote area, you have to make sure you get your little kits that prepare you to have anything that is basic for your essential needs. Now, I always advise people to have the hand sanitizer gel if they cannot be sure they will wash their hands regularly during the whole experience of their traveling. Once you step in the airport nowadays, or even when you would like to get the transportation from your house to the airport, you need to be wearing a face mask. As you rightly know, it has been compulsory to wear a face covering mask in public areas in England. But for the travel purposes, you have to wear a surgical mask. I suggest to have few masks with you because if you are traveling to Cameroon, let's say you will spend at least 6 to 8 hours, 10 hours from your house to where you want to go. So a mask to be useful, you have to wear a mask for 2 to 3 hours. But then it's better to wear one mask for 6 hours than not to wear any mask at all. So, so as I said, from the time you step into the airport, you have to wear a surgical mask, not just a cloth mask, it's a surgical mask. From the time you go to do your check-in, you go through the police formalities and you board. They're not going to ask your COVID-19 test here in England, but from France or from Belgium, depending on where you actually getting your flight connection, you will get asked to show your COVID-19 negative result. Now, this is where I say I have no financial incentive or no financial interest into any airline. But as we stand, if you hold a foreign passport, it could be challenging for you to travel with as in Brussels, because at the moment, they would want you to be either a Cameroonian or a resident in Cameroon. So many people actually discovered that at the time they were trying to board. So far, Air France seems to have had a clear getaway from the Cameroonian government to allow people with different passports to travel to Cameroon. So the same with Ethiopian Airlines. I'm not sure about the other airlines, but as we know, this is the requirement. So be very, very careful when you book your flight or your ticket. Now, once you are lucky enough to get into the plane, that you have, obviously, if you travel in a business class, the physical distancing, because I hate using the social distancing word, I still feel that we can be physically distant but closed socially. So I'm talking about the physical distancing. From the business cabin, there's no problem. There's enough room for everyone. And if you also travel through on the premium economy, which is just behind the business cabin, there is enough space in between passengers. But if you travel in the economy class, you will travel as previously. There is no physical distancing, but I think they have made some changes to change the air within the cabin to reduce the transmission, the spread of the virus. It is important to note that you're meant to keep your surgical mask all the time throughout the flight, except when you're having your meals. Even if you, and also they've restricted the movement within the airplane unless it is deemed essential. This is all measures in order to reduce the spread of the virus. It is important, obviously, as well, to mention that should anyone feel that they are displaying the symptoms or signs of COVID-19, then they should postpone and defer their trip. And I think at the moment it's easier for the airlines to accommodate those unforeseen circumstances. As I mentioned, and as Dr. Ngwa mentioned, we're not here to talk about the criteria to be exempted from wearing a mask, or when people do have any particular medical condition. In all means, it's important to liaise with your doctor, your physician, and ask them the relevant conditions, the relevant criteria based on your particular medical condition. So we are all responsible to protect the general public. Now, let's say everything goes smoothly, you reach Cameroon, and you have obviously, we land to Cameroon, you have to come out of the plane. They actually still have asked people to wait in order to get, each of us need to come out of the airport in a very, very structured manner, just to preserve the physical distancing. And you have your luggage collected by cleaners, and will always be asked your COVID-19 negative result. And that is a bit tricky, important to make sure that your test is also less valid, which means less than 72 hours. There are a lot of paperwork to be filled in, including the one that is a contact tracing paperwork. You give your details, your local details, how long you're going to stay in Cameroon. They ask you, they give general advices as to reduce your exposure to people for the first 7 to 14 days, depending on how long you stay in the country. And it's very important for people to also be aware of that. A lot of us do travel to Cameroon for gatherings, whether it be attending funerals or weddings or other important social events. When we know that we have to attend those events in that particular time, it's important for us to be aware of those measures, meaning that we should wear our mask, we should have hands, we should have physical distancing, and if we display symptoms, we should basically self-isolate. On our return back to England, it is very important to know that there's a compulsory form to fill in, which is a a contact tracing kind of form where they ask you your personal details as usual, your name, your date of birth, your address, your passport number, the flight number, your profession. And this is not very important because certain professions are exempt from the quarantine. The medics are included. So I was told as a medic that I did not require to self-isolate on my return to England unless I was showing some symptoms suggestive of COVID-19. So this is in a very simple and straightforward presentation. My personal experience of traveling recently during this challenging time. I do think that we all know that we have commitments and we may have to travel. And in fact, some people will need to travel just for their holidays because that is part of their well-being. As long as they follow those rules, I do think, I hope, and I think this should help reduce the spread of the virus. This should help us to gradually come out of this pandemic, hopefully very soon. Thank you very much.
Thank you very much, Mathilde, for a very inspiring talk and quite practical as well. I always feel like traveling, and you've just made that heightened at the moment. And I'm so glad you said quite a few things there which are quite practical for us to follow. And just to take on what you said, you did say the government website is very important to consult, which is something I would really encourage anybody to do, because the government keeps updating, and as Riley said, keep updating their information about different countries. Spain was safe a few weeks ago. Now Spain is going to be a quarantinable country, if I can use that word. I've got one question for you there, Dr. Mbok. When you were at we always hear this, that the airports are less safe than the airplane. And I watched last week, there was a newspaper article with people traveling through Heathrow, and the sheer crowd just panicked me because I couldn't see any possibility of physical distancing in that place. Were you at the plane? Did you feel more safe than when you were at the airport?
Well, I think that if you walk in the city, if you walk in London at the moment, it's not as crowded as it used to be, but people don't necessarily wear masks, okay? But in the airport, it's compulsory. So if each of us wears a mask, then it significantly reduces the risk of transmitting the virus. So that's one. Now, when you're queuing, sometimes it's very difficult to experience this 1 meter distance, but 1 meter distance wearing a mask on top of that, and not obviously touching people's, or having washed your hands and having access to hand gels everywhere within the airport areas, significantly reduces the risk. In fact, if we assume that the majority of people are deemed being asymptomatic, even though potentially be infected, but not displaying the symptoms, they're not coughing up, I tend to think that it is gradually safer to travel back, because we have us commitments. We can't afford to have the borders closed. Economically, it's a disaster to make that confinement as longer as it used to be. So we have to have a practical approach on how to tackle, how to reduce the transmission of the virus whilst being still active in our daily lives. So we need, each of us will wear a mask, each of us will have a hand sanitizer gel available at hand. Each of us will get some sort of physical distancing, even though it's not 1 meter that we would like to have. And all those significantly reduce the risk of transmission, I hope, and I think.
Yeah, well, thank you so much for answering that brilliantly. I'm quite happy you did mention the hand washing and sanitizers which is something we have always insisted on all our webinars, that the prevention is the main thing, and hand washing, hand sanitizing, and all the rest, avoid touching your face and your mouth has always been the way to go. We've always emphasized on that, prevention, prevention, prevention. And this brings me to the next question, which I'm going to take. Is from an anonymous attendee who says, how can I protect myself better medication-wise against COVID-19? Should I be taking vitamin C, D? If so, how much?
Well, I think the debate today is not about COVID-19 treatment, otherwise we can spend the whole evening, even amongst our peers. So there is no medication I will obviously suggest the person to take. I would suggest to keep a good, healthy, balanced lifestyle, because that boosts our immunity and that helps us to be more prepared to fight and tackle this virus. So in nowadays, when you are traveling, it's important to feel fit before you travel. So that puts you in a better position than if you are slightly unfit. On top of that, wear your mask, protect yourself, wash your hands, physical distancing, and you will put all the odds on your side, if I must say so.
Thank you very much, Dr. Mbok. And just to add on that, there is as we've said, the UK government actually has said before that those who are not getting enough sunlight need to take some vitamin D supplements. And so that's something we've discussed about. This an association. We're not going to say causation. It's an association. And but our position is get to your GP, get your vitamin D levels checked so you know how much it is. There's no point filling water in a full bucket. But yes, vitamin D, vitamin C. I mean, as Dr. Mbok has also said, it's an immune booster. The dose to take is a bit debatable. Anything from 200 milligrams to 2 grams is fine. The argument is that you rarely get side effects from it anyway. But again, if you're eating healthy fruits and all the right, you'll be getting a lot of those a lot of vitamin C from it. So I think that's the general consensus at the moment. Thank you so much, Dr. Mbok, for a very brilliant start of the conversation. And you said the government website is important that people check. And I'll just give a few tidbits of what the government is saying, the UK government is saying. And they're insisting that you check on the Foreign and Commonwealth Office website on the travel advice before you travel. And they also insist that you check on the latest advice from the destination of your journey. It's very important. I want to think that everybody travels nowadays with a travel insurance. Speak with a travel insurer as well. Now, and that said, let me now quickly go to our second panelist, who I have had a few issues with the airline industry, because it is our benchmark in medical care. We tend to look at what the airline industry is doing in terms of safety, because they're doing an incredible job. And so each time we go for any training in medical care, they always say, you have to see what the airline industry is doing. And our next panelist is the expert in that domain. He is Dr. Mike Fonso, and he is a senior aviation medicine practitioner who works as an aeromedical examiner and a medical advisor for the aviation industry. He was the aeromedical examiner for British Airways, and he is currently the chief medical advisor for EasyJet. As we know, EasyJet is one of the biggest airline companies in the UK. He is the head of the Birmingham Aeromedical Center, which is only one of the 3 centers of excellence in the UK authorized by the Civil Aviation Authority to issue commercial pilot medical certificate. He has served as a medical officer in the Royal Air Force, where he rise up to the rank of chief instructor for aviation medicine. And he served in that Air Force for 12 years. He is also a qualified GP. So he stands the best person to tell us about safety in flying at the moment? Dr. Fonso, the mic is yours.
Dr. Ngwa, thank you very much. I'm just going to share my screen with everyone. And I see it best. I think I've got some slides ready. I think we'll just give a bit of structure for what I want to say, but welcome to everyone and thank you for joining us today. I'm equally going to start with a disclaimer like everyone else. So the views and opinions that I express in this webinar, they're entirely mine, and I do not purport to reflect the opinions or views, official or otherwise, of any airline or authority that I've represented or represent. And I'm speaking in an entirely personal and private capacity and as a member of CamDoc. Right, so the burning question everybody has in their lips is it safe to fly in this COVID era? And when people ask that question, I think what most people are talking about is, what are my chances of contracting the virus on an aeroplane? That's what most people I've spoken to intend by that statement. And I think to try and attempt to answer that question, I'd like to introduce the concept of hazards and risk. Now, a hazard is anything that's got the potential to cause harm, and the risk is the likelihood of that thing, that something, causing you harm. And you could argue that almost any human activity has got the potential to cause harm. So, for example, most people go up and down stairs nearly on a daily basis. Those stairs themselves they're a hazard. So you could slip, you could fall, you could hurt yourself. The question is, how likely is that going to happen? And to answer that question, you probably say it depends. And it depends on what? Well, on several factors. How many times do you go up and down those stairs? How steep are the steps? What is it made of? Concrete, wood? Is there water on it? How fit are you? Are you an able-bodied person, or are you an elderly person? And so on and so forth. So you've got these various factors that would influence how likely it is that you have an accident on those stairs. And then you move on to what we call control. So what these measures that you put into place to try and reduce the chances of you slipping on those stairs, try and reduce the chances of that hazard translating into a risk. So for the stairs example, for example, you put some handrails, people to hold on. You might carpet your flooring. You might wipe any wet on the stairs. If you're an elderly person, you get somebody younger perhaps to help you go up and down the stairs. So those are sort of the controls that you put into place to reduce the risk. So how does that translate then into aviation? Before I go into that, let's talk about, how do you measure risk? So what is it? How do you measure it? Well, there are many ways you can measure it, but a very simple way is just look at how often something happens, how often an adverse event happens. So you often hear the quote that air travel is the safest form of travel. And that quote is pretty much steeped in statistics. It's steeped in looking at fatalities in air travel as compared to other forms of travel. So if we look at road travel accidents, for example, the WHO quotes that over 1.3 million people worldwide die every year as a result of a road traffic accident. Now, if you compare that to aviation fatalities, if you look at 2017, ICAO, the International Civil Aviation Organization, which is the global governing body for civil aviation, they reported there were 50 fatalities in 2017 as a result of aviation crashes. Now that was his best year ever. The year after that, there were over 500. And then last year, 2019, there were just over 230. Now the last 2 years have been predominantly as a result of the much publicized Boeing 737 MAX crashes, one in Indonesia in October 2018, and the other one, most unfortunately, in the spring of last year in Ethiopia. So they contributed to those statistics. So based on that outcome alone, without looking at anything else, just based on the outcome of death, you would say, as a measure of risk, air travel is the safest form of travel when compared to other modalities. So going back to what I was saying before, if we were to translate that now, the principles that I've introduced in aviation and certainly with the COVID era, which is what we want to answer here. So what is the hazard? When you go on an airplane now, like as Dr. Ngwa has described in her recent travels, when you get in an airplane, what is the hazard? So what is the circumstance that gives the potential for harm? And the hazard simply is the fact that you've got many people in a confined space for a period of time, that is the hazard. That's the situation that could potentially cause harm. The next question is, okay, what is the chance of that? What is the likelihood? What is the risk of that harm? And the harm being you contracting coronavirus. That's what we're here to discuss. Just like in the stairs example, it will depend on what? Well, it will depend whether there is a passenger on that aircraft who has got coronavirus. Because if there's no one there who's got coronavirus, then we could all say that will be a nice, happy flight with no problem. So it will depend whether there's somebody on the aircraft with coronavirus. It will also depend where you are sitting. How unfortunate or fortunate are you to be sitting, or let's say unfortunate rather, to be sitting next to that individual who might have coronavirus. And the next issue, or the next factor would be, where's that flight originated from and how long is the flight? Now, obviously, flights that come from countries or areas with high rates of coronavirus infection are more likely to have somebody on board the aircraft with coronavirus infection than otherwise. And also, how long is the flight? Now, we don't have any hard data with regards to coronavirus as to the duration of flight, but when we've looked at other infections, similar coronaviruses and other infectious diseases, and studied them with regards to duration of flight, flights that are longer than 8 hours, including delays on the ground, pose the greatest risk. And if I go back one step, go back to where you were sitting, given what we know about how the coronavirus predominantly transmits, so through the droplets, infectious droplets, if you're sat within 2 rows in either direction of somebody who's got symptoms, that represents your greatest risk on an aircraft. So what about the controls? So I mentioned controls, what you do to reduce that risk. Now, the aviation industry is applying controls across the various actors in the sector. So you're looking at controls with regards to flight crew and cabin crew, controls with regards to the aircraft, airports, passengers, and cargo. The problem is, at the moment, it is pretty chaotic. Dr. Buik described her experience traveling to Cameroon. If you've been somewhere else, chances are your experience would have been different in terms of what the requirements of the country were. So she mentioned about masks. So some countries would ask for a surgical mask, as in France. Some will ask for a face covering. That would be sufficient. With regards to testing, some countries will want you to be tested 3 days before, at least before you arrive at the country. Some will want tested 5 days before. Some aren't interested in testing. Some have forms to fill in, lots of forms, some haven't. So it is a pretty, my words, chaotic scenario out there at the moment. And I think the onus is on you as the traveler, just as you would do to find out what any visa requirements might be. The onus really is on you to find out what the requirements are for the country to which you're traveling. Airlines will help. They will have usually that information because they have an obligation. They will have that information on the website somewhere, and they would have posted that to you. But I couldn't stress more enough, if you were to travel, to make sure that you are familiar and are aware of what the requirements are where you're going, so as to avoid any unnecessary embarrassment. Because of the what I described as utter chaos at the moment, the International Civil Aviation Organization, ICAO, are working on a concept known as the Public Health Corridors Concept of Operations. So they're working on a concept where they would certify crew, aircraft, airports, passengers, and cargo as clean. And by clean, they mean free of coronavirus as far as you can make that statement. So therefore, if you've been certified as such, you can travel from one area to another without having to go through these separate checks because you've got this certification. And they're doing that, working right across industry and with other stakeholders, including people like the International Federation of Airline Pilots Association, various public health organizations across various countries, various national authorities, and so on and so forth, just to make that whole process streamlined and a semblance of what you and I experienced before COVID-19 struck. But we're here, I mean, I could go on and on, but I think we want to probably hear more about what those control measures mean for the passenger and probably mean for the aircraft. So how do you prevent somebody having COVID, somebody who has got coronavirus aboard in your aircraft Well, you do what they call passenger screening. So, and that takes several forms. It includes getting the passenger to think about it before they travel. So they declare whether they've got symptoms of coronavirus, and you tell them what those symptoms are. And you make sure that they sign and that they will not fly with you if they have symptoms of coronavirus. You also find at some airports, you'll find temperature checks. And they could be scanners that you walk through without even realizing, or they could be these forehead thermal guns. And also then we've also talked about testing. Some people require testing. Now, how effective actually are those in reducing or stopping somebody having coronavirus aboard the aircraft? Well, they're effective to various degrees. In combination, as a layered approach, probably more effective than if done in isolation. So if I look at temperature scanning, for example, the Americans looked at some studies covered, they looked at airports across America in April this year to see how many tests actually led to a COVID diagnosis in passengers, how many temperature checks. And they found that of 263,000 temperature checks, only 14 cases of COVID-19 was diagnosed as a result of that. And that translates to 5 passengers diagnosed with coronavirus for every 100,000 temperature checks. Now that for me is wasteful. That is not cost effective. So temperature checks are really not on their own effective. But however, they serve as a deterrent. So for those people who would willfully want to travel when they shouldn't be traveling because they've got symptoms, they might be scared and it might put them off. So what happens also then when somebody slips through the net? Because screening is not 100% perfect. Nobody claims it to be, but it serves to weed out some cases. So what happens then when you have somebody who slips through the net perhaps and boards an aircraft? Well then, compulsory wearing of face masks is commonplace now right across industry. You probably wouldn't be able to fly anywhere without wearing your face mask. So that would then serve to reduce that risk further. And airline operators have enhanced their cleaning. Obviously, they cleaned aircraft before, but there is a added impetus now with regards to the level of cleaning and the detail of cleaning, with particular focus on these high-touch areas, so seatbelts, buckles, all these areas that passengers and crew frequently touch. So you might even board an aircraft and not find your in-flight magazine anymore because it's frequently touched. You might even board an aircraft and you're given hand wipes as you board. You might find that as you board the aircraft, your lunch or your meal is already on your seat waiting for you instead of being served. Again, that just minimizing contact between crew and passengers. But also there are some inherent aspects of an aircraft which actually serve to reduce the risk. So factors relating to aircraft design. So something you wouldn't have thought about, but when you sit in an aircraft, you're usually facing forward, where you are facing forwards. And you're not sitting facing another person. So between you and the person in front of you, there's a headrest. So that serves to reduce the risk of spread of the coronavirus or any infectious disease from further than your immediate environment. And it goes back to that point I mentioned about the greatest risk being within 2 rows in either direction of somebody who's positive. The other factor is actually the flow of air within an aircraft cabin. You would look at, we all adjust the airflow to suit our comfort levels, and you have these you have vents above your head, you have louvers, you have these eyeball gaspers, we call them, those round ball things that you use to adjust, they sit next to your reading light. Now the air enters the cabin from that, so from above your head, circulates a little bit, and it's extracted from underneath your feet. So there's a vertical flow of air in the cabin, and that helps to reduce any horizontal spread or propagation of anybody who might have droplets, again limiting the spread of any infectious disease within that sort of immediate environment of the person who is who's got coronavirus. And then we have these high efficiency particle arrestor filters. Now these are highly efficient hospital grade filters, and they filter bacteria, viruses and other contaminants within the cabin air. And they were certainly the ones used in commercial aviation have the ability to filter particles much smaller than that of the coronavirus. So these all contribute to reduce that risk, that likelihood an infection on board the aircraft. And then also we look at when somebody does become symptomatic, how do you manage them? Typically what would happen is that the individual who develops symptoms on board the aircraft will be isolated as far as that is possible, bearing in mind the numbers of the aircraft. But at the moment, what you would find if you boarded an aircraft, because most of them tend not to be very full at the moment, the passenger would be isolated with their traveling companions, usually to the right and the rear of the aircraft. Might depend on the type of aircraft, but they, generally speaking, on the right and the rear, certainly for Airbus manufactured aircraft, because the outflow valve that dumps air out of the aircraft is in that area. So it just minimizes the spread of any droplets. So those are sort of the controls that are in place. Now, I mentioned before, as I conclude my last slide, that there isn't really much data at the moment. That's all being harvested with regards to how the coronavirus in particular may be spread in the aircraft. We certainly have a lot of information in regards to other infectious diseases from years of experience. But what we do have case studies. There have been quite a few case studies. I'll conclude with one case study, which happened very early on when some of us were very preoccupied with coronavirus way back in January, late January, early February. There was a case when the coronavirus was still an epidemic in China. A gentleman and his other half flew from Wuhan to Toronto, and this is a flight of well over 10 hours. And midway through the flight, the husband developed symptoms. He was coughing, had breathing difficulties, and he was moved to one corner of the aircraft with his wife. And when he landed in Canada, the Canadian public health authorities who published this study, they tested him and he tested positive. They then advised all the other occupants of the aircraft, and there were 350 odd, to isolate, and actually they were to self-monitor at that time and report any symptoms of coronavirus so they could be tested. Over 20 passengers came forward in the subsequent days with symptoms of coronavirus, and they were all tested, and only one of them tested positive, and it was the gentleman's wife. And it wasn't very clear whether she had contracted the virus in her native Wuhan or on board the aircraft. So the point being that the actual risk of spread of coronavirus or any infection on board an aircraft is not as great as some might imagine. I think I'll conclude there in the interest of time. And if you've got any questions, please fire away. Thank you very much. I'll stop sharing my screen right now.
Thank you so much, Dr. Fonso. That was quite exciting to listen to you talk. Quite a few things that I'm learning from there, and quite exciting as well. Now, so to take on what you said, and I'm quite happy you said this, about the HEPA filters. Believe me, when I learned about this, I had to go look it up, because, as you said, that's what hospitals do use, which will never take that into consideration. And you did talk about it. It can filter out the coronavirus, which was very, very comforting to know, because when I look at the size of the coronavirus, it's about 125 nanometers, but the HEPA filters can filter as little as 10, so 10 times less than that size, which is quite important. And I don't know if you mentioned this as well, how much it takes to recycle the air in the plane, which is for a ventilator in the house or an air conditioner in the house, it takes about 5 to 12 minutes, but the plane takes far less than that, which makes that the air is quite clean. Now, my question to you, you talk about the vertical flow of air. If I sit at the airplane then, considering that the virus is spread either by droplets, by airborne or by contact, and have to open up the air vent to the maximum, does that protect me anymore?
Some would argue that perhaps it could actually cause more risk than not. So in terms of, with regards to the management, to try and address your question, if I look at it another way, if in terms of managing the case on board the aircraft, if somebody was symptomatic and they were coughing, spluttering, sneezing, and they were moved aside, every attempt would be made to actually reduce the flow of air from those gaspers, because as you can imagine, those jets can be quite powerful. And if that person is coughing and particularly if that person is not wearing a mask, because for whatever reason, perhaps because they can't tolerate it, and you've got the jet of air coming down at full thrust, there is a chance that it could spread that. So wherever possible, that attempts will be made to reduce that flow in that scenario.
There are quite a few questions coming in now, which I will try and approach. And I think I'm looking for one for you, Dr. Fonso. There is a question here from Mokalantum who says, what disinfectant does your institution or office recommend for airplane cleaning?
Well, again, I must go back to my initial point that I'm speaking clearly in a personal capacity. I'm not speaking on behalf of anybody I represent. So let's make that very clear. Now, I mean, we all know the agents that are effective, well, certainly against the coronavirus, and I imagine most operators will use those. We know the effectiveness of alcohol-based products to a certain concentration, and indeed other chemicals, ammonium-based, and these are much better understood, and they've been widely tested by public health authorities, both in the European Union and in the US by the CDC. And I know for certain that airline operators, in line with their obligations, this is the sort of chemicals that they're using, which we know they're effective against the coronavirus.
Yeah, thank you so much. I think you're right there. We really should have been a question that we'll put through to you. That's not a fair question, I must say. And now there's another question for you, Dr. Fonso. I say, how about the fact that if someone is asymptomatic and thus shows no temperature abnormality and gets off the plane, can they spread the virus under this condition?
So the most common means for spread of the coronavirus is through respiratory droplets. Now, we know that that can happen through breathing. We also know that that can happen when somebody is coughing and releasing those droplets. Now, I'm going to introduce the concept of viral load. We know that we all accept now, and we have understood that, that the coronavirus can be transmitted by people who are asymptomatic. But the greatest risk of transmission is by those people who are heavily symptomatic because they carry more of the virus. So whilst somebody can, in theory, spread the virus, you've also got the mitigation, you've got those control measures that I discussed earlier. So you would have individuals wearing a mask. So theoretically, yes, it is possible, but you've reduced that risk to a minimum by having them wearing, you reduce the risk, let's say, to as low as is reasonably practicable by have those people wearing a mask. The other point I think it's worth mentioning, because a lot of people might probably be thinking about this, social distancing on an aeroplane is simply not practical in the way it is on the ground. Aeroplane travel is quite unique. And Dr. Bouygues sort of mentioned about sort of physical space on an aircraft. Now, it is worth mentioning that there's operational factors will always come first. So the pilot must fly that aircraft safely, and that will be those considerations will trump everything else. So you may actually find yourself on an aircraft where there are quite a few spaces, and it might be a half full, but you find that you're sitting fairly close to other people. Now, there are reasons for that, and the reasons could be that the load masters who've loaded the aircraft and the pilots have sat you, and the crew have sat you in that particular configuration, taking into account the weight and balance limits of the aircraft. So the last thing you want is that the aircraft center of gravity is moved and makes flying unstable. So you may find that circumstance.
Thank you so much. And there's a question here for Dr. Mbuk, which is coming from Joki Manga. I think that the first question, I think that they're multiple parts now. So I just came back from continental Europe on Thursday. When I arrived Heathrow Airport, I did not see or have any check or fill any form for a track and trace. I intend to travel to Cameroon in 2 weeks' time, but I heard you mention that SM Brussels is not accepting passengers with foreign passport to travel to Cameroon. Can you really confirm that?
Thank you, Dr. Moore. As I mentioned as a disclaimer, I do not hold any financial incentive from any airlines. So I'm purely having this discussion based on what is happening. And things are evolving as we speak. So what could happen 10 days ago may not be the case today. This is why it's very important for people to check the websites on a regular basis. I'm not sure, I cannot dispute the fact that he was not asked to fill a form at the Heathrow airport coming from a continental Europe flight. It may have changed, but I'm quite surprised. The fact is that where you receive, so a lot of people have to fill the form before they board the flight, and you get given a unique reference number. This is part of the contact tracing. This is, it was compulsory at the time I traveled, and I don't know what happened to this gentleman, or maybe he did not actually fill the form and was able to go through the gates, but it's normally still compulsory to have this unique reference number in case of contact tracing. I think at the moment, contact tracing is a hot topic within the Republic of England. The other question with regard to SC Brussels, they did not have the license apparently to take on board people who were not from Cameroon or from Cameroon, original resident in Cameroon, up until when I traveled, which was 2 weeks ago. Maybe from, I think at the time I heard that from August, they were probably able to do that. So it's important to approach your airlines and make sure they give you all the relevant advices, because things changes rapidly.
Yeah. I think that's well said. And as we've always said right at the beginning, it's an evolving situation. So we will just have to follow the advice of the day. And the last part of Dr. Manga's question is, are medical gloves important when I travel to put on? I just have a quick say there. We've always insisted on what has been the government advice: wash your hands, hand sanitizers, sneeze in your shirt, in your sleeves, avoid handshake, avoid touching your nose, mouth, and eyes. Some of these so-called protectives can actually be more deceptive. Like you walk into a supermarket and somebody wears gloves and goes around the supermarket, but he touches everything with those gloves and doesn't change them. I think we can't quote models that have been done to say, but I think you'll be more safer washing your hands than wearing a glove and feeling the comfort that is protecting you. Of course, if it is one thing like we do in a hospital, see one patient and take it off and use another glove, that's a different thing altogether. But to use one glove and go around the whole place, I think you're actually carrying disease from one place to the next rather than washing your hands and getting rid of it. So yeah, it's a difficult one to say. There is a question here which I would just like to answer this and stuff. Just recently in the US, Dr. Stella Emmanuel, I knew this was going to come up at some point in time. Dr. Stella Emmanuel talked about taking hydroxychloroquine as a prophylaxis. I will say here that, and I think that I'll be speaking on behalf of my other colleagues, this is a very contentious issue that we're going to spend the whole day, we're not even going to go half of it. And so we cannot make a comment or a statement on this at this point in time. We certainly cannot be able to say whether it is or it isn't, because the jury is still out there. But yes, and I'm sure that on that I'll be speaking on behalf of my other colleagues as well. Now, there is an interesting question here for you, Dr. Mbok, and it comes from Eugenie Mempoa, Dr. Eugenie Mempoa. How safe is the time used to eat on the airplane then without mask? Is it necessary to change mask after food or anytime you remove the mask? What do you think? I would have thought about, again, I'll see what you think about that.
I guess, I think the measures are extremely restrictive, and we cannot say to someone, you have to eat within 5 minutes. I don't think it's practically, it's not possible. So they serve the meals as usual. As you rightly said, the meals get served directly to each passenger. And that during the time you're having your meal, you can't have your mask on. But then obviously you are aware that you should try to focus on having your meals, not just chatting around. Because people used to be when you travel, people used to just walk around, saying hi to people, having discussions. But this is now not forbidden, but people are asked to be seated and wear their mask. This is just in a way to prevent the spread of the virus. So there is no limit of time on how long you should have your meal, but we all need to be responsible with this pandemic. We all need to do our own bit to reduce the risk of transmission. So the crew is there to help. Some people will require assistance. I mean, youngsters, babies, or young people traveling or elderly, and they may take longer to have their meals. But obviously, they're not going to use that time to talk to their next neighbor or whatever. So I think the common advice is to be as safe as possible as we can. We know that we have to travel. We know that we can't carry on having the borders closed, but it's all our responsibility to be safe.
Thank you so much, Dr. Mbok, for that. And there's another question here, which I'll have it go. It says, should anyone be flying at this time besides the economic value? Would you say it is better to avoid traveling by air at this time? Well, I think the government advice at the moment for some countries, including Spain, is to avoid non-essential travels to Spain, including holidays. But again, I'll let Dr. Fonso have another go at that question. I think it's all about safety in traveling then. Yeah. Would you say it is better to avoid traveling by air at this time?
Okay, before I do that, if I just go back a bit to Dr. Mbok's question about the face masks and taking them off to eat. I think you will find that cabin crew are very unlikely to cause anybody any grief, again my words, if they were to take their masks off to have something to eat or drink. That is perfectly acceptable across most airline operators that I've had dealings with. I think you're more likely to have issues perhaps with anyone sat next to you who might feel you've taken too long. But again, there is no definition of what is too long. It's just being reasonable. Just to add to what the point Dr. Mbok made there. With regards to safety flying, I think I'll just echo what you've said there. I think we have to listen to government advice. They've got their experts who are looking at the evidence. And you know, and make sure we follow their rules and don't break them. And at the moment, there are countries and regions and areas where they have issues or they have concerns about people flying to, they would advertise those and publish those on the FCO website, the Foreign and Commonwealth Office website.
Thank you so much for that. And I got a question from Mr. Brian Chekomo. It looks like moving forward, COVID-19 will alter airplane boarding. Of course, it's changed a lot. There is, as we have said here, there is an advice on the government website, and they've advised about planning to travel, getting check-in. They advise online check-in rather than face-to-face checking. They advise that you check your luggages, all of it, rather than having hand luggages, so you minimize contact and you make it easy to disembark. They advise that at the airport, you should ensure that you enter the airport on your own, unlike before where you will go with all your friends and then probably sit in a bar, have a few drinks before you now get onto the plane. Go on your own unless these people are traveling with yourself, and have a face covering as was said, and then follow all the instructions. The airport staff will give you all the instructions on how to do. And the government also says at the check-in, you should avoid touching all the surfaces, clean your hands, wash your hands all the time, and especially when you touch any of the gadgets and checking your baggages. So yes, it's going to change how we board at the moment. And the most important thing is to keep safety as the watchword. And I've got a last question here. I'll see who takes this. I'm afraid, Mike, it's a bit of a tricky question, Dr. Fonso, and I think it's got to do, okay, say since physical distance is not possible on the plane, and we have been told all along to keep a distance of 2 meters, would I be wrong in saying that the airline is only thinking of money?
So it is not that physical distancing is not possible on an airplane. Physical distancing is not as practical on an airplane in the manner that it is practical on the ground, and there are other factors in play, operational factors. I think it is important to remember and recognize that the airlines will always ensure that they work within government rules. So, and as far as I understand it, none of them are operating outside of government parameters. The government published a very clear, UK government, by the way, I'm sure it's similar with other nations. UK government published a very clear guidance, which is on the .gov website, which Dr. Burke referred to, about how to fly safely and how flying can be conducted safely. And that is being done, and that's been looked at by the operators and being adhered to. So I think that's the best way I could answer that question.
Yeah, thank you so much. And I've got one last question here, I'm afraid. It's has there been any changes in consumers' rights with respect to flying due to coronavirus? I'm afraid we're not lawyers, we're not trained in the legal profession, so will not be the expert to give you that kind of an answer. I'm sure the government's website will be able to signpost you best on where to go. We are running up to 7:16, and I think we've had a very beautiful webinar. You must agree with me. All our panelists have been quite brilliant, and as we were able to answer some of your questions. I'm afraid if we don't have time to answer all of your questions, please feel free to contact us via our website, www.camdocuk.org, and you will see a button where you can put your questions, and we will do our best to answer these questions for you. At this point in time, I would, as most of you know, we have been quite involved in raising funds and buying personal protective equipment for our colleague doctors and nurses in Cameroon, and to try and help prevent them from having the COVID-19 infection. I'm not sure how many of you do know that the NHS has suffered massively, but we've had tens of thousands, about 12,000 staff coming down with the infection. And considering the difficulties our colleagues back home in Cameroon are working, we put some resources together and bought some PPE for them. So I'm going to bring the chair lady, Dr. Linda Bello, to just give us an update on where we are with these PPEs, and I'll come back and close the session. Thank you. Dr. Bello, please.
Good evening. Thank you, Dr. Gua, for that introduction, and thanks again to Dr. Burke and Dr. Fonto for that really brilliant, for those really brilliant presentations. As Dr. Gua said, I am the chairperson of CamDocUK, and 4 months ago we embarked on our biggest project to date, which was the procurement of personal protective equipment, PPE, for our colleagues in Cameroon to fight this COVID-19 pandemic. We made a solidarity video for our fundraising appeal, which I'm sure a lot of you have seen. And through your generosity, we were able to raise sufficient funds to enable us to achieve this. So it's my absolute pleasure to announce that our PPE is now in Cameroon. We are hoping to begin distribution in the next 2 to 3 weeks. So we will be posting updates on our website, camdocuk.org, and on our social media pages. So once again, thank you to all those who contributed. And again, thank you for joining us today. See you soon.
Thank you so much, Dr. Bello. Now, it now suffices for me to give a warm thanks to all who have joined us today. It's been quite exciting to have all of you, and we're quite honored that you joined our webinar. I want to thank our panelists, Dr. Mbok and Dr. Fonso, for very beautiful talks. I'm going to thank the support staff as well, Dr. Mbene and Dr. Akem, who have been in the background doing beautiful work. Dr. Akem recently moved to Pennsylvania, and right from the state, he remains committed to CamDoc's ideals. I'm so grateful for everything you guys are doing. If you listen to our first webinar when we were talking about why the Black and minority ethnic groups had more COVID infections and more deaths disproportionately than other races, we gave a multifactorial approach, and one of them was the fact that we mentioned that nutritional aspects was an important thing. We need to actually take that into consideration. I could remember talking about the dietary inflammatory index. Our next webinar will be on the 5th of September, it's a Saturday, and this time around we'll be talking about nutrition and getting experts in the field to talk about nutrition. So please do join us as we embark on this journey of having an engagement with our community. But as I said, if there are any questions that we haven't answered, please get on our website, www.camdocuk.org. And we're also on the Twitter feed, Facebook, and we've got a YouTube page, which I'll encourage you to visit because we're going to put all these videos there so you can watch again. Thank you so much for joining, and have a good night. Thank you.
Good night. Thank you.
Thank you very much, everybody.